You have a patient that has been obese for a while and they've started to exhibit health problems. How can you help this patient? One method is to find the reason that the patient is continuing to live an unhealthy lifestyle. Tell me about how do you feel when you eat? Tell me, what do you think about food? Hello, welcome to English Teacher for Doctors. My name is Mark, the teacher. Thank you for stopping by. Today we're going to be taking a look at counseling and why counseling is important for you and for your patients. So please stick around. Counseling is a tool that you can use to help patients reach desirable health outcomes. Basically, it deals with behaviors and changes in behavior that can lead to a better health outcome for your patient. Counseling can be used for sticking to medical treatments such as medications, unhealthy behaviors, psychiatric and mental health issues. Counseling is an effective tool that you can use to help your patients get on the road to recovery and to a better health outcome. Today, we're going to look at 3 different ways that you can use to counsel depending on the patient and the situation. The first one is the 5 A's. The second is frames. And the third is bathe. Remember the patient that I just mentioned that has obesity? And I had asked the question, how do you feel when you eat? This question brings us to the 5 A's. Let's see what the 5 A's are. Originally used to counsel smokers, it can now be used to counsel patients with a variety of different health concerns. It is often considered an intervention model. The purpose is to be non-confrontational, non-judgmental. Ask questions. Ask questions and permission to get some information from the patient so you can help them better. Assess the patient's feelings, triggers, and beliefs, as well as their idea about the problem. Often is it okay if we talk about how do you feel when you feel, what do you think? Advise on the benefits of quitting or changing behaviors. A good idea might be right now I think it's a good idea for you to assist by offering realistic tools and goals to help the patient achieve the desired outcome for them to quit or change behaviors. One way to do this is arrange follow-up with scheduled appointments and check-ins. Let's set up our next appointment. Please check at the end. I will give you some more examples of language you can use for the 5 A's. Let's move on. Feedback. The first part is letting the patient know that his or her behavior is causing health problems. I know you enjoy, but this might be causing your current health problem. Responsibility. Responsibility is giving the patient different options and choices for them to choose and take responsibility for their health and to get to a better health state. What do you think you can do to advice? Advice is giving suggestions, not orders. Be careful not to order the patient and tell them that they need to do this today. I know you can guide it with a simple question. What do you think you can do to cut down on smoking? Menu of options. Menu of options is actually giving concrete advice. So there are 3 things that we can do today to help you. Medication, counseling, certain therapies, whatever it is that you can provide the patient, you provide them a menu of options, 1, 2, and 3, so the patient can decide. Empathy. Empathy is showing that you understand the patient, that you feel for them, that you know what the patient is going through, that the patient is suffering, and maybe the patient has had a difficult time talking about this. It's important to listen carefully to what the patient is saying. I know it's very difficult for you right now. Thank you for coming in today, and thank you for sharing that. Self-efficacy. Self-efficacy is if the patient believes that they can make the change. It is all about the patient believing that they can change and follow through with the advice and suggestions that you give. This requires you to discuss the realistic possibilities for a patient to quit smoking. Is it realistic for this patient? Important to remember, it's up to the patient to decide. What do you think will slow you down on this road to recovery? One thing is to make sure that you're not judgmental. Judgment is very detrimental to a patient. You want to make sure that you are using open questions and that you're talking in a reasonable voice and that your language is tailored to helping them and guiding them, not judging them, not using words that judge them for perhaps things that were beyond their control. Now, if you're working with some patients that have some depression or other mental disorders, there is another approach. The acronym is Bathe. The first step is to elicit the background, B, from the patient. This gives you an idea of what the patient is going through. I'd like to know what has been going on with you recently. Can you share that with me? Next is to find out how the situation has affected the A part or impacted the patient's life. How do you feel about this? You can then talk about the trouble, T, with the patient. This means talking about the trouble that it is causing the patient, and you can start getting more input and start making decisions about what is going on. What troubles you the most? You can then ask the patient about how they are handling the problem. How has the patient been handling or coping or dealing with the problem that is causing them this mental stress or this situation? How have you been dealing with this? Lastly, provide empathy. This is important because it'll let the patient know that you understand them, that you understand that they're going through a difficult time, that it's tough for everyone, that it's tough for them, and that you are there to listen to them and not be judgmental, that you want to help. That must be very difficult for you. Background. Tell me about how life has been for you lately. Effect. How has this influenced or affected you every day? Trouble. What are you worried about that might happen? Handling. What do you normally do when you feel that way? Empathy. It's been hard for you, I can see that. You're very brave to come in and talk about it. Ask. I'd like to talk about your weight issues with you. Would that be okay with you? Before we begin, is it okay to talk about these issues? Assess. When do you feel like eating snacks? How do you feel when you eat? Advise. Well, eating too many sweet and fattening foods can cause you health problems. Health issues are very serious. I know it's difficult, but I'd like you to consider your health before choosing something to eat. What do you think you can do to cut down on snacking? We have a great nutritionist here if you'd like to meet. Feedback. Let's talk about what's going on with you. Your weight can be causing some serious problems with your health. Responsibility. It's important to know that you can do something about it. What do you think you can do today? Advice. At this point, I think you should start to cut down on eating oily foods. One option, menu of options. One option is to track your foods on an application. Empathy. I know it's been very hard for you. Thank you for coming in and sharing that with me. Self-efficacy. Are you confident in your ability to change? Do you keep trying when things get difficult? Within the three types, there is a lot of overlap. Empathy, responsibility, and giving suggestions are all part and parcel of counseling. Remember, counseling is a tool to help a patient make a change in a lifestyle that is going to result in better health. Smoking, eating, diet, sexual health practices, recreational drug practices, even adherence to medication. Those are all important things that you can counsel. Thank you for stopping by. I hope you enjoyed this video. Please consider liking and subscribing to this channel. English Teacher for Doctors has a lot of content that is coming available to you. Lessons about communication skills, as well as resources for international medical graduates who want to work in the United States and another English-speaking country. Thank you again for watching. Until the next video, have a great one.